Hello. My name is Pharm Usifo Ngozi, a clinical pharmacist with the University of Ilorin Teaching Hospital. I work in the HIV facility. I want to talk about World AIDS Day. World AIDS Day is celebrated on the 1st of December every year. HIV is a major public health issue that affects millions of people worldwide. Significant progress has been made in combating the disease in recent decades, but the important global target for 2020 was not met. The COVID-19 pandemic was a major deterrent in this. The theme of World AIDS Day 2021 is End Inequalities, End AIDS. The World Health Organization is calling on global leaders and citizens to rally to confront the inequalities that drive AIDS and to reach people who are currently not receiving essential HIV services. Some inequalities faced by HIV/AIDS patients include lack of access to HIV services due to political, cultural, or economic constraints, unequal gender norms, patients with disabilities and geriatrics, stigma and discrimination of people living with HIV/AIDS, HIV-related criminalization that enhances vulnerability to being infected. The effects of COVID-19 on HIV/AIDS include people living with HIV/AIDS are at a higher risk of COVID-19 infection because of their compromised immune system. Repeated visits to HIV clinics increase the risk of contracting COVID-19. The lockdown led to people living with HIV being unable to access treatment. Interruption or HIV prevention program, reducing public enlightenment. What are the pharmacist's roles in reducing inequalities and ending the AIDS pandemic? These include ensuring the availability of safe and effective medicines, monitoring and reinforcing the need for strict adherence, management of drug interactions, provide reliable information on the use of alternative medicines, counseling and patient education, medication reconciliation, prevent new HIV transmission by using proven interventions such as PrEP, PEP, and PMTCT, etc. In conclusion, to reach the 2030 target of ending AIDS, it is imperative that enlightenment, advocacy, and change in policies that increase inequalities against people living with HIV/AIDS be deployed. Effects of COVID-19 were cushioned by increasing patients' drug availability and reducing the need for monthly visits to HIV facilities, thereby reducing exposure to the virus. Also, delivery of drugs directly to the patient's residence improved medication availability during the lockdown. Patient counseling, adherence monitoring, and drug reconciliation by pharmacists aid reduction of inequalities. Therefore, let us join hands to end inequalities, end AIDS, end pandemics. This information is brought to you courtesy of the Drug Information Unit, University of Ilorin Teaching Hospital, Ilorin. Thank you.